Sorry guys, I'm back. Got cut off due to a phone call. One of the hazards of recording this on my telephone. Hopefully I'm going to get an iPad soon and I can do them there, and then we won't be bothered by all of this. But picking back up with those operational indicators, I think I just finished off with pharmacy refill turnaround times. And so we still have lobby wait times and then claims processing turnaround time. So those cover your operational indicators. Then over on 143, we go over to our medical indicators. Medical indicators also are referred to as outcome measures because they express the MCO's ability to obtain a successful outcome from the care that's delivered. So some of our medical indicator examples are the percentage of members receiving prenatal care in the first trimester, percentage of babies born at or above an appropriate birth weight, percentage of operative patients without a wound infection, unanticipated emergency room visits within 24 hours after surgery, unplanned emergency department visits after a primary care visit on the same day, and rates of mammograms, pap smears, immunizations, and physicals. And then your financial indicators can be measured using the following: days in claims payable, which is calculated as the reverse of days in accounts receivable, or claims payable at the end of the period divided by the average claims per day during the period, hospital bed days per 1,000 members, and the number of avoidable hospital days. So if I give you one of these on a test, be able to tell me whether or not it's operational, medical, or a financial indicator. Then at the bottom of this page, we have tools from the AHRQ. The Agency for Healthcare Research and Quality, or the AHRQ of the U.S. Department of Health and Human Services, has developed several tools that can be of benefit to managed care organizations as well as other healthcare organizations. And a few of these tools are the National Guideline Clearinghouse. It's a database of evidence-based clinical practice guidelines. Then you have the National Quality Measures Clearinghouse. It's a repository for evidence-based quality measures and measure sets. And then we have the Consumer Assessment of Healthcare Providers and Systems, or the CAHPS system. It includes standardized survey instruments for assessing patients' experiences with ambulatory and facility care. And it also provides access to comparative data through its benchmarking database. Then we're going to drop down to utilization management. So utilization management is part of the quality improvement function of an MCO, as well as a method of cost control through prospective and retrospective review of services. And these activities consist of pre-admission certification, which involves reviewing the necessity of an admission prior to its occurrence, pre-authorization, which is a review of elective procedures requiring prior approval for reimbursement, concurrent review, which is reviewing services ordered for medical necessity during an inpatient hospitalization before they're provided, and discharge planning, which is arranging services that patients may require upon discharge. All right, so now we're going to move over to page 145 and finish up with risk management and legal issues, and then we're going to flip over to the role of the health information manager. So risk management is a managed care. Risk management in managed care is more comprehensive because of the wide variety of services provided under the managed care concept. Each of the facilities included in the managed care organization, both owned and contracted, monitor for potential risks that are unique to its own settings. Documentation of care coordination between these settings is essential in managed care because patients believe that managed care means that care happens or should happen seamlessly across many facilities. If this does not happen, patients may see their care as less than optimal and consider litigation. So in identifying unusual events are reported and tracked within the MCO. Unusual events represent a primary source of litigation for MCOs, similar to other healthcare providers. Unusual events can be a delay or denial of services that are later determined to have been necessary or emergent, failure to direct a patient to the proper source of care, or any medical incident that normally is tracked elsewhere, such as an incorrect administration of medication. And then informed consent for procedures. Providers within the MCO use the same procedures as other providers when they obtain informed consent from patients or their legal representatives before performing procedures. In addition to individual liability on the part of the physician or facility, the MCO is at risk for being a party to a malpractice suit. Then we have credentialing. Credentialing is a process of review to approve a provider who applies to participate in a health plan. Specific criteria and prerequisites are applied in determining initial and ongoing participation in the plan. The MCO performs its own investigation or contracts with an independent credentials verification organization, a CVO, to conduct credentialing reviews. NCWA offers a certification program for credentials verification organizations. The prerequisites that are evaluated include the credentialing elements verified traditionally by hospitals, and these include current competence in the field, work history, physical and mental health status, challenges to licensure and registrations, limitation or termination of clinical privileges, pending professional liability actions, felony convictions, Federal Drug Enforcement Administration registration, and National Practitioner Databank information. And we're going to skip all the way down to contract management. Again, be sure to read this entire chapter because, again, we're hitting the highlights in the PowerPoint. So dropping down to contract management on the bottom of 146, the MCO is built on a contracted relationships. An index of contracts, including expiration dates and any proposed contract changes, is maintained to be sure that all contracts remain valid and at optimal level of reimbursement. All right, and now we're moving over into the role of the Health Information Manager. You can read a spotlight on managed care on page 147, but we're going to go ahead and flip over to 148. The Health Information Management professional in managed care is found mainly in the staff model, group model, and network model, HMO, performing the traditional role of Health Information Manager. These HMO settings require the HIM professional to maintain security and confidentiality of records. In addition, the HIM professional performs data collection and coding of encounter data. The HIM professional is concerned with information storage and retrieval, appropriate information technology within the facilities, and personnel management. As in other facilities, this person normally participates extensively in or leads the preparation for an accreditation survey visit. Then we have our specialized functions. Number one is going to be enrollment management. The enrollment database in an MCO is a highly detailed version of a master patient index, an index traditionally maintained by the HIM professional. The HIM professional's knowledge of data management and patient identification systems provides some of the best foundation possible for performing or supervising the enrollment management function. And then we have our claims processing and management. One of the largest databases maintained in most MCOs is the claims database. In addition to managing the claims database, the claims processing supervisor helps to determine whether claims are coded properly and are acceptable for payment. The HIM professional's medical knowledge, combined with financial experience or ability, can prepare him or her well for the role of claims processing supervisor. And then we have quality management and performance improvement. Specialization in quality management or performance improvement by the HIM professional is likely in a managed care organization. Knowledge of all areas of healthcare provides an excellent foundation for leadership role and performance improvement. And risk management. HIM professionals frequently fill the role of risk manager. The HIM professionals' study of medicine, management, and the legal system provide an excellent background for performing the duties of risk manager, which include looking for ways to minimize for potential injuries, responding promptly and appropriately when injuries occur, and planning for potential liability resulting from injuries. A related function is that of a credentialing specialist. An HIM professional may perform this function for the MCO directly or for a credentials verification organization. Some HIM professionals serve as chief executive officers or in other management positions in CVOs. And the last one, chief information officer. The information technology expertise of the HIM professional can easily be used to perform the role of chief information officer for managed care organization. So be sure to read through the trends and through the summary. And again, make sure you pick up all of the text, read the entire chapter. I've told you a couple of the things that you'll be matching in the test. I'll go back through those real quick. back on page 130, table 4.1. The Accreditation Association, NCWA, the AAAHC, Joint Commission, URAC, and what those apply to. So you'll match those on test. And then back over on, let's keep going here. Oh, yes. Your 131, your ratings, your different ratings, how the premium payment can be determined. Community rating, age, sex rating, composite rating, experience rating. Be able to match those as well. And then again, you need to know over on page 134, table 4.2, the advantages and disadvantages of the different types of reimbursement to the providers of care. So for salary, an advantage is predictable revenue for the provider regardless of the patients in the panel. And a disadvantage for a per diem is good historical data is required to negotiate an appropriate rate, and they may not have that data. So be sure to kind of know those. Happy study, and talk to you later.